Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr. And as you can see, I have on my ribbon for World AIDS Day, and the month of December, is AIDS HIV Awareness Month. It is my hope that something that is shared today you will find inspiring, educational, or give you the nudge that you need to take care of your health and the health of those around you. I have Tom Bachanga today. He is here as the Executive Director of Diversity, Equity, and Inclusion for the Aliveness Project. We are going to talk about the new Thrive Pharmacy that just launched at the beginning of December. We're going to talk about prevention, awareness, and reducing stigma. This is going to be a wonderful episode you won't want to miss. Tom Bachanga, I am so excited to have you here representing the Aliveness Project. Welcome to the program, Community Connections.
Thank you much for inviting us.
Now, I am familiar with the Aliveness Project, but I'm sure there are a few people that are watching that are wondering what is the nature of you all's work. Can you give us a little bit of a timeline on what you all do here?
First of all, I can go back and explain a little bit how the Aliveness became to being.
Please.
The Aliveness was started in 1985 by men who were living with HIV and AIDS. You know, around that time, the epidemic was there, but there was no cure. The men kind of witnessed their friends dying, but they wanted to have a meal together even before they die. So they formed the Aliveness Project to have a meal. They called it a padlock, where they could meet for a meal. And that kept on going to a point where it came to a point now they needed to apply for funds. When they got the public funding, that's when it was open to everybody else to provide services, assisting people living with HIV and AIDS, and also doing prevention for those at risk of HIV infection.
I'm so excited to have you here while we further a very necessary conversation around HIV, AIDS awareness, and prevention. And my hope is that we're able to connect people to the services and programs that you guys offer, because we know that now at this juncture, much different than it was early on, that this is no longer a death sentence for many people.
It's not. And again, that's why a lot of money has been put into treatment, because it's known that people living with HIV, once they get linked to care, chances of them spreading the virus are very low. So the medication is so good to a point where if you stick how the medication is prescribed, the chances are you have 99% of a chance that you may not pass on the virus. We also know that people of a high risk of HIV infection congregate somewhere else, more especially like homeless encampments. So we also send our team there to do prevention part of it and education piece. So also we make sure we test those ones who are at a high risk of HIV infection, and whoever tests positive, we make sure we link them to care right away, because that way we are avoiding getting more people infected by treating the one who just tested positive.
That is really important. Now, you guys offer member-based services as well as public services. Can you explain to me the differential between the two for somebody that probably is interested in looking you all up and going, well, what's going on, or what's the difference, or what is going to be the two separate experiences, or are they similar?
Most of them are kind of similar, but there are a few which are not similar. When we call it member service or member-based, you have to live with HIV and AIDS to access all services at the Aliveness Project.
Okay.
And the non-member is like you can come in for HIV test, you can come in for PrEP. I don't know if people know what PrEP is.
Please explain that to
PrEP
viewers.
is the medication that individuals of a high risk can be prescribed if they are at a high risk, that can prevent you from acquiring the HIV, even if you are involved on a very high risk of HIV infection. But when you are on that medication, you cannot catch the virus. So that those services are provided there, and the majority of those are free to the public as well.
Can you repeat that for people that may be hesitant?
Yes, some of those services, like PrEP services, some of those are free, to public, more especially to people of low income or no income. But again, another thing that I was going to say is more especially for immigrants. More immigrants, let's say African born or whatever, they are afraid of accessing those services there because they are afraid they think it's the government who might know who they are. Please, all services that are provided there are free and open to everybody.
I think that's beautiful. In this economy, we know that a lot of people are nervous about trying to save money, or is this going to be flagged on my insurance if I receive this care, and will my significant other know? Will someone, my employer or someone in my family know if they see these services on my insurance documents? And you guys are saying that you are able to provide testing and support for free. There are some services available.
Yes, and again, let's say somebody who does not have insurance, they test positive. We make sure we find insurance for them so that they can be able to get the medication. They don't have to have income for them to have insurance. So once you test positive, all those are the barriers. We make sure you have transportation. We make sure you have insurance. We start working with you to make sure you get housed if you are not housed. And make sure, because also we provide meals, we make sure you access those meals, because people living with HIV and taking medication without meals, it's so tough. So that's why we provide meals Monday through Friday. Also, we do food shelves. Some people call it food bank. So they can come in and get about 60 pounds of food that they can cook when we're closed, because we're closed Saturday and Sunday.
And that takes place Monday through Friday, you said?
Yes, Monday through Friday. They can come in and they get 3 hot meals cooked and packed for them to take with, or they can sit down and have a meal, and they can take like 2 meals with them.
It sounds wonderful because you all are providing wraparound services. I don't know about anyone else, but if you're ill or if you're experiencing a hard time, worrying about where you're going to live or what you're going to eat only exacerbates the issue. So it sounds like you guys are able to start providing, like I said, wraparound services that not just take care of the issue medically, but also taking care of the person and providing a real sense of community.
Yeah, social services are big because also that we provide what they call case management, more especially people who are new to the field. Let's say you are newly infected with HIV. You don't know where to go for resources. You don't know how to apply for insurance. That's where you are referred to a case manager. Case manager, their job is to navigate the system for you, more especially to find you insurance, to refer you to housing if they can't do the housing directly. They can make sure you have transportation to access the services you need. So those services are available for them so that they can make sure that we break all the barriers that pass people getting into care.
Now, you all are providing all of these different services and programs to the community at large. Is the Aliveness Project working with any existing community partners while they're tackling such an undertaking with the community, or are you guys doing this independently? We
partner with there are several other organizations who does the same job, and we work very much in conjunction with them. More especially, we have another organization in the rural. It's called RAN. It's in the rural communities. We work with the Hennepin County. We work with Sub-Sahara. I think they take care of the East African communities. Okay. We work with Mwenyegeting also in Brooklyn Park. It's also like a Kenyan-based organization. We also partner with them to do testing, and also we make sure if they find somebody who is HIV positive, they don't have the capacity of connecting that person, they call us. We have connection with the clinics where we can connect somebody right away.
Now, I was doing a little bit of homework before we did this interview today, and I realized that you all have staff that work for you all and volunteers that have been touched by HIV and or AIDS, either personally or throughout their networks. How does that work to start to help people foster community, but also have someone that knows what they're going through?
I'm glad you asked that question, because in our staff and in our volunteers, so we have also people living with HIV as staff. And more especially during outreach, if somebody tests positive and they are surprised or they're crying right there, those people who are living with experience, immediately they become like a mentor. They say, by the way, I'm also living with HIV and AIDS. This is what I did, and this is what we can do for you to move on. Also, the volunteers come because they want to give back, because the agency has helped them a lot. And we hear a lot from some of the people living with HIV that if it was not the Aliveness project, I would not be alive. So it helps to explain the new people to the program and make them realize that they can still live with HIV and live a normal life.
Now, I'm sure you, as well as many other staffers at the Aliveness Project, just have a wealth of knowledge around HIV and AIDS awareness. But how are you guys connecting with the community on prevention and raising awareness and education? Because I think for a long time there was such a stigma tethered to HIV and AIDS because of what we were hearing pushed either throughout the community or from the media. And now I think it's much different, or hopefully it's starting to shift in a different way.
Yeah, and again, that's a good question as well, because also at the Aliveness Project, we have outreach department, and their job is to go out to the communities where we know that most people at that community, those communities that are at the high risk of HIV infection. They educate them of the importance of getting tested. By educating them now, you are removing stigma, because they know once the people who are also, let's go back a little bit there. People who stigmatize are the people who are not living with HIV. That's where the education need to be emphasized on. Because people living with HIV, they don't stigmatize. The people who stigmatize are those ones who are not living with HIV. The education, that's where we take education to educate the community that is not living with HIV, that for your, let's say, for your loved ones to live a normal life, not for them to seek help, you need to understand how HIV is spread and how it's not spread. How HIV is not spread is not well educated to people. So people need to know that you cannot transmit HIV by being around somebody who's HIV positive, by eating, sharing utensils, by using the same toilets. So those pieces right there, that's where stigma starts. If people are educated on that, then you eliminate stigma.
What has been the community response to the work of the Aliveness Project?
And again, different communities respond differently. I've seen, more especially the African communities, are kind of resistive for us to take the education there. There are communities where we have been ridiculed, more especially when we went to one community, I'm not going to name the names here, where we were saying that, please, when you know your loved one is living with HIV, don't stigmatize them, because for you, you should be a support for them so that they can seek treatment. We were told, if we know you are HIV positive, we will stigmatize you. So, and that's not all communities, but there are those communities who are still resistive by us taking the education there. But again, now that most communities are educated, stigma is going low, and lots of people are seeking treatment.
That is very disheartening to hear that people are still perpetuating such stigma in society when we know that it's not easy living this life, period, let alone with an illness that can be treated and that is providing such unique experiences for people around us. And
again, like I said, it's like a commercial when we're doing all this education. It's like a Pepsi coming on TV 20 times during the Super Bowl. It does not necessarily mean that if you see it once, you get it. Yeah. So we kind of persist on going back and forth, trying to use different models to educate that community. If it's necessary, we hire somebody from the same community who speak their language to take the information there. And actually, that's what we have done at the Aliveness Project. When we are targeting a certain community, we hire somebody from that particular community because they are trusted, even though some of the communities don't want their own people to know that they are HIV positive, but taking the information is easier than when people know that you might know my status.
Now, you talked about hiring someone when you're working with minority communities that speaks their language. But at the Aliveness Project, how are you guys making sure that all your education and or awareness materials are linguistically sound?
We look at whom we serve. We know the communities we serve. more especially we know a lot of minorities like the Spanish speaking, Somali speaking, Swahili speaking, and Native American speaking. We have translated our English materials to 4 languages.
Okay.
Yeah, that's made it easier for when we're doing outreach. People can speak in their language, and even when people coming for services in there, if English is not their first language, and if the material is translated in their language, actually they even feel comfortable that the community cares when they see something written in their language. So we have translated the language into 4 different languages. That's Somali, Swahili, Ojibwe, and Spanish.
Okay.
Yeah.
Okay. Now, I just want to talk a little bit about how you guys are using ethnic media like us here at OROMIA11, as well as any type of social media outlets to engage communities at large. Because the reason we're able to have this conversation is because I saw an amazing TikTok you guys had talking about the uptick in the state of Minnesota in cases of HIV and AIDS diagnosis.
Actually, we have an external relation department and they're the ones who put out that clip that you saw there. And for you inviting us, this is a big thing because these are the people we want to use because they speak their language. When they see somebody in their TV, they know that they care. So we have gone to other media, which are bigger media like CARE11, WCCO, but this is powerful right here. And we'll continue. That's why I say I was interviewed sometimes back in one of and that you looked familiar. So we try as much as we can because we know when people see their own bring the message, it's more powerful.
I think that's very true. Now, you all just celebrated the launch of the Thrive Pharmacy on this past Sunday, the 1st, which was World AIDS Day. Can you talk about the work of that pharmacy?
The launch started this last Sunday. The pharmacy will be functional probably in a few weeks. We have not started dispensing medication yet.
Okay.
Yeah, but it should be opening very soon. So the work of that pharmacy is going to make it easier for people to access their medication. When people go, let's say, to the hospitals and they get prescription there and they leave to come back and get the medication, sometimes they don't come back. We have services that our people need every day. So sometimes they are there, they can go and get their medication. People who don't have transportation, but they find themselves at the Aliveness project, it's going to make it easier for them to be able to be on meds versus when they're required to either travel 2-3 passes to go get their medication. Also, we're reaching people who are not housed. Sometimes people who are not housed, they don't walk around with their medication because of the stigma. So by having the pharmacy within Aliveness project, and we serve about 2,000 people living with HIV a year, so those are the people who will access medication that some of them would have not accessed the medication.
I think that's very powerful. Now, can you provide us with the information, the location of the pharmacy as well as of the Aliveness Project, if there's someone at home watching this that is interested in stopping by or starting the conversation around taking care of their own health, whether it's getting tested, whether it's utilizing the food shelf, or just coming in to volunteer? Right.
The Aliveness project is located at 3808 Nicollet Avenue South, Minneapolis. Zip code is 55409. We have a website, aliveness.org. And we are using people all the time, more especially people who provide us with the volunteer services, people who need to access the services we provide. One thing I wanted to say, when the pharmacy opens, I want to encourage people to use it because we can deliver. Let's say somebody lives in Duluth, we will make sure they get their medication. It can be delivered.
So you all have a delivery option.
We will have
as
a
well
delivery
for people
option.
that
So
are
if
interested.
people don't want to come to Aliveness, but they can send in their prescription, then it can be delivered.
This is going to be life-changing work. I'm very excited to hear about this.
We are hoping it will. And again, I know, more especially in the African communities, now I want to know what the needs are because my boss has been asking me now, Tom, with the farmers coming, what are the projects you want to see in the African community? There's a saying in my language that don't cut the baby's umbilical cord before they are born. So I said, let's open the pharmacy, and I will go to the community. Then we will see the needs, and then we will let you know how Aliveness can find those.
I think that's a beautiful saying, but also an even better sentiment that you guys are going to make sure that people don't have to come to you, but you guys are going out to make sure that you meet the need.
Exactly.
Of Aliveness. Now talk to me, Tom, about what keeps you personally connected to this work.
First of all, I'm originally from Africa, Kenya. I grew up in a poor community. The people we serve right now are either low income or no income. When I sit and help somebody who has been struggling, it's very rewarding to me, so it keeps me going. That's why I keep doing the job.
I hope that as you continue, you guys start to see a decline in numbers, not only nationally but globally, so that worry will begin to dissipate just a bit more every day.
We are hoping so. Right now, from 2020, the Twin Cities, there have been an outbreak in the Twin Cities for HIV.
Yes,
HIV
please
cases.
talk a little bit more about that.
And the Duluth started 2021. In the last year also, we saw an uptick of new cases by 24% in Minnesota, which is not okay. When you look at Wisconsin, Iowa, those cases are not there, but they are concentrated in the Twin Cities and Duluth. So that's a concern. But our team is always out there, more especially with these encampments. We have a van that goes out there with food, with harm reduction materials. We make sure we test everybody out there. And whoever tests positive, we make sure they're linked to care right away.
That's really important. Hopefully that someone is watching this is interested in getting tested so that they know their status. They are practicing safety if they are using any type of intravenous drugs whatsoever, but they also are talking to their partners about their status to make sure that they are operating from a place of safety always. And if not, I hope that they are contacting you guys at the Aliveness Project.
That's what we are looking for as well. Also, we're always in the community as we're talking about HIV. Also, we talk about other programs that we provide, more especially harm reduction. Harm reduction is provide like clean syringes for those ones who want to shoot whatever their drugs. We make sure if they want to do that, they're doing it cleanly. Because with or without, they might use unclean syringes, and that's how the infection get transmitted. So we make sure if they wanna do that, they're doing it safely. And we also, the team talks about the opioid crisis, fentanyl crisis. All of those, we have a team that goes out and educate people on that.
Now, one more time, please provide the phone number for the Aliveness Project and the web address.
The phone number is 612-822-7946, and the website is aliveness.org.
Thank you so much for joining me today, Tom, for this episode of Community Connections. It has been a pleasure to talk to you, but also to learn more about what you guys are doing at the Aliveness Project. And it's my hope sooner rather than later to come by in person and get a chance to see everything. Please come and see the new pharmacy. Come and see where we're located. We're inviting you for lunch. We provide lunch every day. I would love that. Unfortunately, that is all the time that we have for today's episode of Community Connections. As always, I am your host, Anna Orr. This has been Community Connections, airing right here on OROMIA11. I look forward to connecting again with you soon.